Hi everyone, Dr. Emmy from Walkaway Back Pain and Pain Free and Fit. Today we're going to be going over how to choose terrain with your walks, as well as integrating your unique corrections for assistive back pain corrections. Hope you enjoy. So keep in mind, when developing your own strategy and your own workout design for a walking program that helps with back pain, there's a difference between active versus assistive or passive exercises. Today we're going to be going over how to integrate terrain as well as your own unique corrections for assistive exercises. Assistive walking exercises are those which don't use as much energy, you don't have as much focus because you're using the ground and terrain to assist the correction. This is a great time to use this when you've just had an acute aggravation of your back pain. You don't have as much energy. Let's say, for instance, today I'm doing this assistive walk because I'm a bit tired still from my big leg workout 2 days ago. You don't have as much energy. You want to use the ground and the terrain to assist in the corrections and use less of your own corrective muscular power. So, again, with all our corrections, we start with an analysis, knowing what our unique problems are. For me, of course, my correction that I'm going to be going after today with my assistive program and how I design it is based on the fact that I like to externally rotate my left leg. As I walk, I like to hold that leg outwards more than my other side. As a result, it causes a hip hiking tendency where the hip comes up on that side, a weak multifidus muscle on that side, and compression on the left side of my back. I'm also prone to leaning to the left. I've identified this through an analysis that I've done on my body. Your corrections may be totally different than this. Your walking strategy is going to be based on your own unique body mechanics and how they relate to your lower back symptoms. So today I'm going to use a crosswalk, and I'm going to choose a terrain, a hill that has a slight slope to it where I can walk with my left side down. Now why is that? Because now the ground is assisting dropping my left hip lower than my right. Remember I said part of my back pain problem is when I lean to the left my back is aggravated. When I raise my left hip up it compresses my disc, facet joints, whatever problem I have on my left side. So I'm not going to be walking this way on my walk because that would actually create compression on my left side, but I'm going to be walking this way with the downside of the hill, allowing my left hip to drop. The other thing I'm going to be doing is I'm going to be emphasizing my left buttock contraction a little bit because through my analysis I've determined that my left glute is my weaker side. So as I walk on this terrain I'm going to be squeezing my left glute and trying to keep my left leg in. As I walk downhill there's a natural tendency for my body to fall, and many times what the body does is it externally rotates that downhill. So I'm going to use a little bit of active correction in holding my leg in and preventing that external rotation as I walk cross-hill. As I do this, I keep myself tall. I use all my other corrections that I've used, that I've learned through my analysis for my back pain. And after a 10-15 minute walk, my lower back symptoms are actually better because I've engaged the weak muscles such as my multifidus, my glute. I've helped to decompress the left side of my back by keeping my left side low compared to my right. And I've trained my left hip to internally rotate, which wakes up the internal rotators, decreases the pressure on the external rotators like the piriformis, and relieves lower back symptoms. If you had a situation where your back pain was aggravated, let's say, by extension, such as typical case of spondylolisthesis and stenosis, you may want to choose an uphill walk because as I walk uphill, the natural tendency for my body is to fall backwards. I then have a compression of my abdominal muscles and it prevents that extension as I naturally lean forward. As you walk uphill, your body wants to stay away from leaning back. So assistively, with a lot less muscular usage, I'm going to naturally lean forward as I walk uphill. That's going to decrease the extension symptoms of my lower back. Conversely, if let's say I had a typical disc or acute disc problem that's aggravated with bending forward or flexion, I'd actually like to choose some downhill walking for my assistive program today because as I walk downhill, the natural tendency is for my body to fall forwards. So what does the body do? It naturally leans back. This is something that you don't even have to think about. It happens reflexively. So as I walk downhill, naturally bending backwards, and the tilt of my feet and pelvis into an anterior pelvic tilt helps to increase that arch in my lower back, decreasing the flexion stresses of disc. And after walking downhill for a while with my other unique corrections, I'm going to typically feel better with my back pain. So think about increasing your knowledge of what your unique problems are mechanically and relating those to the terrain choice for your walks to feel better with your lower back symptoms. If you want to learn more about walking away back pain, check out our full program. It has all your analysis, all your corrective exercises, how to integrate this into a walk, how to design a walking program to be the main rehabilitation or self-rehab program for your back pain. At painfreeandfit.com, we have the Walk Away Back Pain program. I hope this video on walk away back pain, considering terrain choice with your passive or assistive corrections, helps you with your lower back symptoms.